Hello, my name is Dr. Ajay Phadke. We all know that diabetes is a very common condition in India. India is now the diabetes capital of the world, and there are a large number of people who suffer from diabetes and its many complications. Diabetes actually affects the blood vessels of your body, not just your large blood vessels but also the smaller blood vessels. This is what we call as microvascular complications. Now, we are aware of all the tests which we use to diagnose diabetes, the most important tests being your fasting and post-lunch glucose and your glycosylated hemoglobin. Your glycosylated hemoglobin gives an average of your 3-month glucose values. So this is to diagnose diabetes. But what is a way in which we can also check if diabetes is affecting your vessels of your kidneys? So there is a test for this as well. It is called the microalbumin creat ratio. What this basically measures is it takes a urine sample and it looks at the amount of albumin in the urine and the creatinine in the urine, and it takes a ratio of these two molecules. If the ratio is above 30, it is said that you will have microalbuminuria. That means you have a small quantity of albumin which is excreted in your urine due to some microvascular damage because of diabetes. Most people who do not have any microvascular damage will not have any albumin in the urine, or will have a very small quantity which is less than 30 in the urine. So what is the significance of this? This tells you that the diabetes has started to have some kind of impact on your kidneys, but the good part of this is that a lot of this is reversible. So with lifestyle modifications, with weight loss and with the correct antihypertensive medications, we can also stop the onset or the progression of this disease further, and in some cases even reverse it. So it becomes very important for a diabetic patient to check for this. Another important point is that even if the creatinine in the serum is normal, this can still be abnormal. So it's an important factor to consider. Apart from the fact that it tells you about diabetic nephropathy, which is the kidney complication of diabetes, it will also tell you if you are going to be at higher risk for cardiovascular events and even stroke. So it will give you a risk for stroke and cardiovascular events as well. It is important to monitor this. If it is high, you will need to consult your physician to take the appropriate treatment. So that's all for today. Thank you.